Thank you, Madam President. I first want to give a thank you to everybody who's working right now and all the folks that are required to be here with the Senate in session. And I wish we were focused on those things right now that were directly related to making sure everybody's going to be able to continue to be safe and to focus on what we need to do to safely reopen the economy rather than what we are voting on this week. But I want to thank all of you for being here. And I also want to send condolences and thoughts to everyone who has lost a loved one in this crisis. We are approaching this weekend 100,000 Americans. And if that doesn't give us a sense of urgency right now to effectively address this health pandemic and to get this right and to work together, I don't know what does. So I rise today with a real sense of urgency. And I think it's important to understand how we got here so we know what we need to do going forward. Because on January 20th, the first case of COVID-19 was reported in the United States, same day as the first case in South Korea. Our White House didn't act. They were unfortunately more worried about the stock market than people in the supermarket. In South Korea, they did act. Within 8 weeks, they were testing 40 times more people per 1 million of their citizens than we were. And by April 14th, they had 10,000 cases, and we had over 600,000 cases because there was no sense of urgency to do what needed to be done to take this seriously. And now we know that we are well beyond that. Unfortunately, on the American side, in the weeks and months that came after January 20th, the White House slow-walked declaring a national emergency. They failed to quickly implement widespread testing that was being done all around the world in every other country. And they dropped the ball on getting the essential medical equipment and supplies our doctors and nurses still need to treat people and keep them safe. Their reckless delay made us the world leader in the number of COVID-19 cases and deaths. And when you think about it, we're a little over 4% of the world's population, and yet we have about 30% of the deaths because of lack of urgency and inaction at the very beginning to be able to get our country's arms around this deadly virus and what was happening. Now 4 months have passed and more than, as I mentioned, 90,000 on to 100,000 Americans have passed away from COVID-19. Think about that. When we look at over 90,000 lives, that's as if a whole city in Michigan just disappeared from the map. Yet the White House and the Republican leader and our friends across the aisle continue to show a lack of urgency about this crisis. On March 14th, the House of Representatives passed the family's first coronavirus response. It had a whole range of things that were incredibly important in it. COVID testing, so you could get free testing if you needed it, increased Medicaid funding for states, extended unemployment help for more workers. It established the 14 days of paid sick leave for people who lost their paycheck because they had to stay home because of the virus. And the bill provided nutritional food for moms and babies and families. Yet the Senate leader felt no urgency to pass it right then. You know, the House passed a bill on a Friday night, middle of the night. All we had to do was stay till Saturday and we could get it done. But there was no sense of urgency for the nurses and the doctors and the unemployed workers and the small business owners and the hungry families. They had to wait. They had to wait for the next week for the Senate leader to go home for the weekend. And they had to wait until the next week. The leader returned to Washington, but his sense of urgency still wasn't there. So while the White House didn't act and the Republican leader didn't act, I'll tell you who did act. The governors acted. Democrats and Republican governors stood up and leaned in to protect their citizens. I'm so grateful for what our governor and her great team have done in Michigan, and all of our mayors and local communities that leaned in, taking whatever resources were available to put them right out there to make sure people's lives were being saved. Number one priority. And they've been stepping up and taking actions needed to save lives over and over and over again in this crisis. And frankly, that's what the White House said should happen. Remember the words of President Trump when he tweeted, "Governors must be able to step up and get the job done. We will be there with you all the way. We will be there with you all the way." Unfortunately, when he said all the way, he actually meant find your own way, which puts us where we are right now, today, and trying to help them get resources for critical state and local services. And the vacuum of federal leadership has real-life consequences. Today, I released a report that shows the price American families will pay if the White House and congressional Republicans refuse to support state and local services. Our Democratic Policy and Communications Group, supported by all of our Democratic senators, are saying we have to act. There are real consequences. Families and communities will pay the price if we do not act and step up to have their back. Through no fault of their own, our states and local communities are facing critical budget shortfalls, up to $650 billion over 3 years, which far exceeds what states lost after the Great Recession. Far and away more than what they lost in the Great Recession. Without urgent federal assistance, these cuts will affect our safety, our children's education, and our quality of life. But the Republican leader said he has not yet, quote, felt the urgency of acting immediately. Maybe states should go bankrupt, he said. Well, I can tell you, the White House and the Republican leader, I can tell them who feels the sense of urgency. It's the healthcare worker who's been laid off and doesn't know when he'll get paid and what he's going to do to take care of his family. He's feeling a sense of urgency. It's the student whose school might have to be cut back, and the teachers that are going to be laid off due to the severe budget cuts. They feel a sense of urgency. The woman who can't continue treatment for her opioid addiction because of cutbacks at her local community behavioral health center. She feels a sense of urgency right now. The community that's cutting back on its police and fire departments and the 9/11 call centers to save money because the president said that he'd be with them all the way. You know, he's saying, no way. You're on your own. They feel a sense of urgency. And the mom who's waiting hours in line, in her car, at the local food bank, to try to get some food for her children, for today, not next month, not, hey, we got 2 or 3 months. She wants them to eat today, and tomorrow, and the next day. She feels a sense of urgency. Americans across the country are feeling a sense of urgency, and it's urgent that we act to meet this moment so that they understand in this horrendous moment and through no fault of their own, the health crisis, the economic crisis, and so on, that somebody really does have their back. We need to help our state and local governments continue paying vital workers who educate our children and keep us safe and provide all the essential services. We need to extend unemployment benefits so that people who are out of work will be able to pay the rent and feed their children. We need to improve access to healthy foods for families in need right now. We need to create a heroes fund to ensure that essential workers who have taken the most risk to keep our country running, to keep us safe, to save lives during this pandemic, receive the additional hazard pay, the compensation that they deserve. They need to know that they are essential and not expendable. And just saying thank you is good, but it's not enough when you're worried about paying your own mortgage while you go to work to save somebody else's life, or put food on your own table for your family. Our country can do better for them. That's what the House bill did. That's what the Senate needs to do. And we need to invest in our state and local health departments so that we can continue to fight the virus and keep our communities safe. That should really be a no-brainer right now, the fact that we need to support our health departments who are on the front lines of tracking what is happening and getting the critical information so the right decisions can be made to keep us safe, and the right decisions can be made about how to safely reopen our economy, which we all want and know it needs to happen. Actions have consequences. I'm here to say that inaction also has consequences. Inaction has consequences. We're losing lives, we're losing time, and every part of the economy is being affected. It's time to act. It's time for this Senate to act. Not on more judges over and over and over again, but to act on the things that the American people need to have happen, that the people of Michigan need to have happen so they can be healthy and survive the virus, and also be able to survive economically for their family, for their business, for their farm. Mitch McConnell may not feel a sense of urgency, but I do on behalf of the people of Michigan. It's time for the Senate to act. Thank you, Madam President. I yield the floor.